you pregnant and you were told you have placenta previa? That is a condition where the placenta partially covers or completely covers the mouth of the cervix. In today's video, I'll be talking about all you should know about this placenta previa. So stick around in today's video. My name is Nurse Favor and I'm a registered nurse by profession. If this is your first time of seeing my post, don't forget to like this video, comment on it, share to your family and friends, and you can save for later because you will definitely or someone you know might need this video. There are various types of this placenta previa. The first one is complete one, the one that in which the placenta completely covers the mouth of the cervix. Another one is partial, when it is partially covering it, that is, it is not complete covering of the cervix. That is, your placenta is not on your cervix. That is, it partially closes the cervix. So the next one is marginal. Marginal is when it is near the cervix but not completely covering the cervix. Then the next one is low-lying placenta. Many people will go for ultrasound and they will tell them that they have this low-lying placenta. What it means that your placenta is somewhere close to the cervix but not partial, not covering the cervix at all. So this type of low lying, in some cases vaginal delivery is still possible, but the one of complete and most time partial cesarean section is the only option. Who is at risk of having this placenta previa? The first thing is people having twins. You get, because in twin pregnancy, some twin pregnancy have multiple, all these multiple placenta, so it can attach anywhere inside the womb. Then another thing, people that have had previous cesarean section or scar, this can predispose you to this placenta previa. Then the next thing is those people that have undergone IVF procedure can also increase the chances of coming down with this partial or complete or any type of placenta previa. Then the next thing that can make someone to have this maternal old age, that is women that are above 35 that are getting pregnant, you know, by then they might have been a multiple children after before that pregnancy. So the placenta have detached in so many places of the womb. So it might now come to the mouth of the womb, which is the cervix, to come there to attach or near the cervix because it is looking for a smoother surface. Those people that have had this placenta previa in the past, if you have had placenta previa in the past, that means most times your subsequent pregnancy might also end in this. Common sign you will see that will tell you that this placenta previa is happening to someone. The first thing is that the person will be having painless vaginal bleeding, maybe bleeding after an intercourse, or sometimes you start seeing you bleeding out bright red blood coming out from your VJ. So this can be a sign that there is something wrong. That is, any bleeding at all in pregnancy should be evaluated immediately. So bleeding is not something you should joke about during pregnancy. It can be a sign of many things: placenta abruptio, placenta accreta, and the rest. Abnormal baby position. Once there is placenta previa, it will predispose the baby to stay abnormally in the womb. Imagine that the placenta is covering the mouth of the cervix. It can make the baby to be in breech position. It can make the baby to lie transversely and the rest. So this can predispose the baby to lie in abnormal position, which can lead to cesarean. How does this placenta previa affect your baby? It can lead to preterm labor. Yes, it can lead to preterm labor. It can lead to the placenta detaching early. That is placenta accreta. That is the placenta to detach early, causing bleeding, and it is very dangerous for the baby in utero. So the next thing is it increases the chances of cesarean section, where the placenta is completely covering or partially covering the cervix, you know that this birth is definitely cesarean section. Nothing two ways about, because the placenta cannot detach before the baby, else the baby will be drowned in blood and the baby will be dismissed. So this is only indication of cesarean section when the placenta is partially or completely covering the cervix. But in case of low lying, it depends on the part of this low line where it is in the womb. This can also be manipulated and vaginal delivery can still be. So treatment of this placenta previa, ensure you have enough bed rest when you are confirmed that you have maybe complete or partial placenta previa. Ensure you have bed rest, and also ensure enough pelvic rest. That is, avoid heavy lifting, anything that can make you to heavy lift. Then avoid sexual intercourse when you are confirmed that you have this placenta previa, because it can lead to bleeding. Then the next thing you should do in treatment of this is blood transfusion, where the woman is constantly losing blood. This can be a help to the woman to replenish the lost blood. Then another thing is early delivery. These people that have this placenta previa are often monitored closely and given and being sectioned early in case of complete or partial placenta previa, because they don't want the placenta to detach and something might happen to the baby. So the delivery is usually conducted around 36 weeks. As early as 35, 36 weeks, they have already conducted the cesarean section. So if this video have added value to you, don't forget to like this video, comment on it, share to your family and friends, and see you in my next video.